Hello and welcome to UTS Startups Confessions. My name is Dave. I'm a capability coordinator here at UTS Startups, and I am a little bit jealous of the man sitting to my left. This is Dr. Steve from NeoGenix. So Steve, tell us, what is NeoGenix? What do you do?
So NeoGenix is a medtech startup. We develop technologies to find and select the best sperm for IVF. So we're treating infertility.
Wow. Okay, that's a pretty big space. Has anyone had their sperm checked in this room?
I have.
No?
Just me.
Why do we care about this? Why is IVF important? Why is it interesting? Why is it difficult for men?
Yeah, it's crazy. Not a lot of people realize that about 1 in every 6 couples experience infertility. So it's a lot. And we have IVF as a treatment option, but another thing that people aren't really aware of is about 78% of IVF cycles fail, which is huge. And a big part of that is the technologies that we use to treat patients, and particularly when we're selecting sperm for IVF, are super outdated. Okay. We're using technologies that were invented 30 or 40 years ago. We haven't changed much since, right? So now there's a real push for innovation in IVF to kind of bring it forwards and improve those success rates. And another thing that's really interesting, historically you see a lot of innovation on the female side of things, so eggs and embryos and drugs for women, which is super important, but there's not a lot that's been done for sperm in particular.
Are sperm that sensitive?
Very sensitive, particularly human sperm. About 30% of all infertility is just male factor infertility. And about 55% of the time, it's male and female factors together that combine to be a big issue for couples.
Okay. Wow, okay. How does that shake out?
So what that means is, in all IVF cycles, what happens is you need to collect eggs from the woman and sperm cells from the man, right? And sperm are super important because they become half of a child's genome, right? Yeah. So it's super essential that we pick healthy, competent sperm. And if we select damaged sperm or compromised sperm, then we get all these downstream effects on embryo quality, gets worse, our risk of miscarriage goes up. Yeah. If you're using a DNA damaged sperm, you can almost triple your chance of having a miscarriage. So it's a huge thing in IVF to select the best, most competent sperm. Okay,
so we need good swimmers.
Yeah.
Right, so we need our Thorpes and our Dawn Frasers, right?
Yeah, we need the Olympic level sperm.
Okay, yeah, great, okay. So we need Olympians.
Yeah.
Okay.
That's it.
How do you find these Olympians?
Yeah. So that's one of the technologies that we're working on. So we've developed a device to select the best sperm for IVF, and it is essentially really an Olympic race that we put the sperm through. What we have is a hardware and a software solution. So we have hardware for processing semen, so guys with motile sperm. And what essentially that device is doing is mimicking the environment inside the female reproductive tract to make sperm think, oh, I'm inside the female body, I know what I need to do. The better ones know what they need to do, and they'll be guided by some mechanisms to be selected. Wow. And then we take those and then we use them for IVF. We also have an AI called Sperm Search, which is for severely infertile men who don't have any sperm in their ejaculate. And they go through a surgical process to find sperm. But these are super rare instances where the sperm are super rare. They might only have 2, 3, 4 sperm amongst millions of other cells. Yeah. So finding those sperm is extremely difficult.
Yeah, right. Okay. So you're talking about all the way down, we've got almost no chance of conceiving.
Yeah.
Right? It's like, wow, how
really hard. Yeah.
Yep. Exactly. And then you're touching all the way up, all the way through IVF.
Exactly. I think we're the only startup that has a solution for the whole spectrum of male infertility. We're really catering for all the types of cases that you see across male factor infertility. But not just male infertility. When a couple is going through IVF, and no matter what the issue is, you always need sperm, right? So sperm selection is always essential in all IVF cases.
Gotcha. Okay. So what kind of, if we're looking at millions of sperm, what's a good number for sperm, right? If we're talking about, we've got to find a handful, how many are we normally dealing with?
Yeah, so what we define as infertile, healthy sperm count really is anything about 40 million sperm per milliliter of semen. Sounds like a lot, like 40 million sounds like a lot, but even in a healthy guy, maybe about 50% or so of those sperm don't even swim. Only about 30 to 40% of them swim well. Right? I always describe sperm synthesis or sperm production as like a factory with no quality control, and they're just pumping out units, and it's just go, get them out the door, go, go. And that's what we have to deal with, right? So it's a massive sorting task, right? If you're getting, on average, like 9 to 12 eggs from a woman, that means you need effectively 9 to 12 sperm, right? So how do you pick the best sperm, those best 9 to 12 sperm from 40 million, or some guys might even have up to 200 or 300 million, right? So it's a massive selection criteria.
Yeah. Okay. Anyone on LinkedIn next week who's thinking that you might have 200 million, Steve will help you out. I feel like so what's the deal with picking the right sperm? I understand that if we've only got 12 eggs, we need 12 right sperm. What is it? What is it that makes a sperm good?
Yeah, there's a few things. In the female body, there's a dozen plus selection filters that they go through. So we're replicating some of those elements in our devices to mediate selection, right? But we look at their motility, so their velocity, how fast they swim, their behavior, we look at their morphology as well, their shape, how well they're put together. The big one that we look for and we try and select through our device is DNA integrity. What that means is how intact is their DNA. Literally physical, we're trying to avoid physical damage in the DNA of the sperm, because then that can lead to lower quality embryos, miscarriage, and so on.
Wow. And you can figure that out with your tech?
Yep. That's
wow. Doesn't that sound great? How are you? Okay, genetic mutation, unreal. What does it look like? What's the process look like for one of your patients who's going to go from collecting samples all the way through to pregnancy?
Yeah, I mean, there's no hot to involved, but when a patient comes in, like I said, we're getting sperm from the man and eggs from the woman. That's happening typically in a fresh IVF cycle in parallel, right? So a woman's come in, she's been on drugs beforehand to produce multiple eggs, and on the day of collection, the day of treatment, while the eggs are getting collected from the woman, the semen sample has been given by the man, and we have a time window to do all this processing, because sperm and eggs aren't meant to be outside the body. Right?
Well, yeah, that makes sense.
Yeah, so we need to process that semen quickly and efficiently and reliably to get the best sperm to then fertilize the eggs. And there's a few methods of fertilizing, but the main thing is that you're always going to need sperm and you're always going to need eggs, right? So part of the value of the tech that we're providing is not only are we giving better sperm, but we're doing it in less time and less steps, and it's a lot more consistent. It's a lot more robust than the conventional methods, which are very manual. They're very skill-based, right? Okay. So we're kind of giving better tools to embryologists who are performing these tasks to select the best sperm.
Wow. Okay, so is this something that is going to completely change how people do IVF?
It's going to definitely, it's a paradigm shift for the sperm selection element of IVF. But obviously the potential benefits flow all the way down to improving live birth, potentially. Okay. And that's what we're aiming for. That's the real goal, is to improve IVF success for infertile patients, right?
Okay. How's that going?
It's going really well.
Okay, good. That's good news.
So we've just done 2 separate studies. So for our device, we've done a side-by-side in 50 patients, which is soon to be published. We did a comparative where embryologists used our devices compared our devices against the conventional method, and we beat the conventional method in DNA integrity, that DNA structural integrity, in every single sample, which is fantastic. Every single sample we were better, which is terrific. Yeah.
Okay.
Yeah.
Wow.
And then our AI product, which is for these severely infertile guys, that product is for guys who have an IVF surgery. So they get a testicular biopsy. So we go on and, it's intense. We take a biopsy of the testicle, and traditionally embryologists will spend up to about 6 hours looking for sperm. It's a super rare sperm.
Oh, okay.
You can imagine looking under a microscope, 2 embryologists typically for 3 hours each, so about 6 hours in total time, looking for sperm. So it's a literal needle in a haystack scenario.
Oh, this is when you're talking about trying to find individual sperm.
Yes.
Whoa,
Exactly.
okay.
Yeah.
It takes you 6
So
hours
this
to
is
find.
severe male infertility.
Wow, okay.
Yeah,
Okay.
yeah, and it's an extremely labor-intensive task. So we've got an AI which sits with the embryologist to scan through these samples rapidly and rapidly identify sperm and pick them out. So we're averaging about a 60% search time reduction per sperm, which is fantastic.
60%?
60%, yeah. We actually got our first pregnancy.
Hey,
just recently, which is
how
very,
good's that for
very
pregnancy? Yeah, good job. Fantastic.
Very, very excited. That was a fantastic case. So we obviously severe male factor infertility patient come in. We had 2 unassisted embryologists, so doing the standard practice. They found 3 sperm across 2 people. 1 AI-assisted embryologist found 12, so found missed sperm. What that meant was, and in less time, by the way, than the 2 unassisted ones.
Yep.
And what that meant is we could fertilize most of that woman's eggs.
Yeah.
Right? That's the real value there. We got embryos from the AI-assisted sperm, and then we transferred one, and now she's pregnant. So really, that was a go, no go. If we weren't using the AI, we weren't implementing it in that patient case, then we
So that'd be
wouldn't have got
like
many embryos.
potentially 3 embryos versus 12
Potentially,
embryos.
yeah.
Potentially.
You're increasing the chances.
But like 4x.
to fertilize. Yeah, 4 times.
Wow.
Yeah, which is fantastic.
That sounds like a lot.
Yes, yeah, it is a lot.
Okay, and how many people are doing this? Is this like IVF is a big thing that we all know about?
Yeah.
How big is it?
Yeah, it's not actually very well reported how many cycles are done globally. We think there's about 3.5 million IVF cycles globally. In Australia, we're doing about 115,000 IVF cycles a year.
Yep.
But the good thing is, all IVF needs sperm. And we're working very closely with Virtus Health, who's the largest IVF service provider in Australia.
Fantastic.
And we've just deployed our AI to their Melbourne site as well as the Sydney. So that's in treatment patients now across these 2 sites. We're hoping to hit about 12 sites in the next year for the AI.
Yep.
And then as we go through the regulatory process for the devices, we're hoping to hit really about 40,000-50,000 cycles over a year and a half, 2 years. As we
Okay,
scale.
great. And so you've got AI where we're doing 12 sites, and it's AI, right? So it's constantly happening, right?
Yeah.
But then when we're doing these cycles, is that this is your hardware, right?
Yeah.
And is this excuse if it's a silly question, but are they buying one and then they're reusing them?
No.
Okay, good.
I don't think you want to be using a second-hand
I don't think you
sperm
would,
device
no.
from someone else.
So for every single
they're
cycle, we need
consumables.
one of these
They're
devices.
single-use consumables. Yeah,
Unreal.
Exactly. They need to come sterilized and packaged and clean, fresh for every
As you would
sperm
hope.
selection you do. Yeah,
As you would hope.
Exactly. Yeah. So that gives us obviously a recurring revenue model. The clinic's doing a lot of sperm selections. Day to day, right?
Yep.
So looking at, once we scale in and we scale to that 40,000-50,000 cycles, probably about 10 million annual recurring revenue from those devices as single-off purchases.
In Australia alone?
Australia alone, yeah. Ooh. And then we bounce off, obviously Europe is doing a lot. IVF's kind of located in hotspots across the world. It's 5 or 6 countries in Europe, they're doing a lot of IVF. Obviously China and the US, big markets as well.
Yeah, giant markets.
Huge.
And we've got declining birth rates and hopefully...
Declining birth rates and declining sperm counts. That's another huge thing.
Declining sperm counts?
Declining sperm counts. So we've seen about a 50% reduction in global sperm counts in the last 40 years. Yeah.
It's halved?
We've got less sperm than we did.
Are we running out of
years ago.
sperm?
We're basically running out of sperm. Yeah.
Okay.
Which is a bit scary.
Yeah.
It's very scary.
I thought the bees were scary. This is way scarier.
This is way scary. But we don't really know why. We can attribute to a few things. There's studies recently that have come out that have found microplastics deposit in the testes and can affect sperm production. Air pollution, lifestyle, diet, all these different things. Age is another big factor in infertility as well.
Yeah.
Typically we're seeing people are delaying their first pregnancy and then having issues later.
Yep. Yeah, that's only natural,
So that's
right?
a big part of it as well, yeah.
Yeah. Okay, so this all sounds phenomenal, if I'm being honest. I don't see any doubt. It sounds like you've just gone plus, 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 plus.
It's been pretty good.
In medtech, though, you mentioned it, clinical trials.
Yes.
As someone who's heard a few ideas pitched to me about medicine, I have always thought that it sounds great, but it sounds a bit hard.
Yeah.
What's it been like for you?
So far, our clinical validation has been fantastic. I think we've partnered with the right people We've done some trial manufacturing out of South Australia and in Melbourne to kind of de-risk the device. Obviously, for the device side of things, we are looking to do a trial, and that's what we're raising for at the moment, is to run a clinical trial on that. And it is a significant barrier for medtech companies. I think for us, though, we're a little bit cheaper in our trial costing compared to oncology or other things that you would expect. Primarily because we exist so early in the IVF cycle, in the treatment life cycle of the patient, right? We do the sperm selection, the fertilization happens, and we get immediate metrics, which is fantastic. And then the rest of everything is standard care. We monitor how the embryos go, the implantation, if there's a miscarriage, live birth, and so on and so forth. So we've got a really good trial protocol set up for the device. And then for the AI side of things, we're a class 1 medical device. So we're doing the submission now, actually. So very soon, we're hoping to hit that and then roll that out to Australian clinics.
What's a class 1 medical device?
It means it's a low risk medical device,
that's
which
good.
is fantastic. Yeah. So it means we don't need, there's not as much clinical validation involved. Obviously, there's documentation that you have to provide around AI and what it does, but it means that we can enter the market very, very quickly. Yeah, and we're already in treatment, right? We're already in treatment patients, and we're seeing the benefits. So
unreal.
We've already got data.
Man, talk about traction. This is what traction looks like.
Very well.
So what's next? What's next on the horizon for you guys?
So at the moment, we're raising. We're raising the seed round. Yeah, that's it. So that's to get us just over 24 months worth of runway, get us through that manufacturing setup for the devices, get us through the trial, and get us to a TGA submission for the devices. For the AI side of things, it's really to help us scale in Australia and pump through and get to more clinics. That's the main thing. As far as the AI goes, we've already deployed in the UK. So we're working with Burn Hall, which is the first clinic in the world to do IVF.
Okay.
Yeah. So we're putting the AI in there. We've done demos in the US, in Hawaii, in Singapore, in Dubai as well. So we're going to set up, we're about to deploy next month in New York, which is fantastic. Yeah. And then we're looking at Hawaii and Dubai next as well. So it's going very, very quickly on the software front. And then same thing with the devices. People are super, super keen. So we're going to send devices to, again, the US, to Dubai, and also to the UK.
Whoa.
So there's a lot going on.
So I'm going to quickly make sure that I understood everything. Well, not everything, but you've got two offerings, one hardware, one software. Combined, we're talking about incredible improvement to fertility and having babies. Something that's from your PhD?
Yes.
At UTS?
Yep.
And your UTS startup?
Yes.
Into your series, or your second seed round?
If you want to call that.
Seed round, second round.
Second round, yes.
And you're already an international startup.
Yeah.
Isn't that amazing?
Going really well.
Isn't that amazing? Well done. Well,
it's been a roller coaster.
Yeah, I bet. It's no surprise that NeoGenix then is one of our coolest and most successful startups. We love having you down here, Steve.
Thank you.
For anyone watching online, we're going to turn the cameras off shortly and get into the really juicy stuff. We've got a really full room here, as I'm sure you heard, and you're missing out. So get down here next week and you don't miss out on the juicy stuff. We're going to turn the cameras off now, but everyone please thank Steve for being here with UTS Confessions. Thanks, buddy.
Thank you.
Well done, mate.
Thank you. No, that was great.